Good day and welcome to another edition of Ignite Health, brought to you in collaboration with Caribbean Surgery Inc. I am your host, Dr. Surendra Persaud, the Medical Director at Caribbean Surgery Inc. As always, this program is dedicated to empowering you, our audience, with trusted medical information, expert insights, and practical advice to help you take better control of your health. Today, we are continuing our series where we are looking at the various forms of substance abuse. We previously spoke about alcohol, and today we are going to be discussing a condition that many people sadly still underestimate. And what are we talking about? We're talking about tobacco use and tobacco abuse. We are going to be hearing from persons who have had challenges with tobacco abuse. So let's start at the very beginning. What exactly is tobacco use? And when does tobacco use become an abuse? Tobacco use becomes abuse when nicotine addiction keeps a person using it despite serious health risks. It is a form of substance abuse. It's not just a habit. Now, how widespread is tobacco use globally, and what has been the effect of this drug worldwide? We anticipate, in a world where we now have possibly more than 7 billion people, that approximately 1.3 billion people around the world use tobacco. And it causes more than 8 million, let me say that again, it causes more than 8 million deaths every year. And so all entities that manage public health consider tobacco to be a leading cause, or tobacco use, a leading preventable cause of death globally. Now, how does tobacco damage the body? All of us have seen that if you look at a pack of cigarettes today, health agencies around the entire world have been able to pass legislation such that the effects of tobacco on the organs gets displayed on the package. Now, one of the things that, we'll go over the actual organs in a little bit, but I would encourage everybody to take a look at that pack of tobacco. And there is no subtlety to what is displayed there. It shows you the diseases affecting the lungs. It shows you the diseases affecting the heart. It shows it as a risk to multiple cancers, affecting fertility, and that it reduces fertility, causes premature aging of the skin and bones. There are very, very few diseases that we haven't linked back to tobacco and smoking. So smoking is responsible for about 85% of lung cancers. So, and another condition which we call COPD, chronic obstructive pulmonary disorder. This is where the tobacco is actually causing direct damage to the lungs. And that damage then impairs the person's ability to get in enough oxygen. And that COPD is a secondary or a separate cause of increasing risks of heart disease and stroke. I would like to have a more detailed discussion on why, as healthcare providers, we are extremely concerned about tobacco. Many of us would have heard in the health sector, we speak about non-communicable chronic diseases. We are all aware that cardiovascular disease are a significant component of these so-called package of non-communicable chronic diseases. We know that cardiovascular disease is in the top maybe 1, 2, 3 causes of deaths in Guyana and in the world. Now, what is cardiovascular disease and what does this have to do with tobacco? Cardiovascular disease is a condition where the blood vessels in our body get damaged. And one of the leading causes of damage to the blood vessels is tobacco use. And so one of the things that we are always discussing is how do we work on reducing that? So let's say somebody already has cardiovascular disease, and all of us are gradually developing cardiovascular disease. Why is it important to reduce or even quit your tobacco? Because what we have found is that tobacco is one of the leading causes of damage to these blood vessels. And so as the blood vessel gets damaged, it narrows. And so reducing or working towards quitting your tobacco is very, very important. And as we have mentioned, you're not likely to succeed the first time. You're not likely to succeed the second time. We know that many persons who are trying to quit tobacco, it can take as many as 10 attempts before you are successful. But we really, really need you to work on quitting tobacco. Now, let's talk about how tobacco affects specifically the lungs. So as we all know, persons are smoking. You have the filter for the person who is actually smoking, and that filters the tobacco, the nicotine, and other chemicals the smoke is still going into your lungs. And that tobacco causes direct damage to the lungs. One of the more common conditions which we've mentioned is COPD, chronic obstructive pulmonary disease. And this is a condition where the lungs is being directly damaged. Now, what do our lungs do? When we inhale air, our body extracts our lungs. So we have the branches of the lungs, and it's a single cell, and we have oxygen in the air on one side and blood on the other side. And that is how we extract oxygen from the air when we take a deep breath, and that is what the oxygen we need to live. When you have a direct damage to the lung, these persons are no longer able to efficiently transfer the oxygen from one side of the lung to the other side. So we spoke about tobacco in its effects on cardiovascular disease, which is one of the possibly first, second, and third causes of deaths. We have spoken about tobacco as it relates to its high incidence in lung cancer, and also to its high incidence in some direct damage to the lungs with COPD. Now, when you have this situation where you're unable to extract adequate amounts of oxygen, or when you change the lungs, that leads to a strain on the heart, and it leads to heart failure and additional conditions such as stroke. Now, why is nicotine addictive? As with all substance abuse, there is a chemical that is causing the brain to react. So nicotine in the brain triggers dopamine release, and dopamine, as we're all familiar with, creates a pleasurable, or it reinforces a positive feeling in the brain. Now, over time, the brain then is becoming dependent on this pleasurable feeling, and it's becoming dependent on the nicotine just to feel normal. Now, when the person who has that cigarette, we all notice that there's a filter. And that filter, so what the person is inhaling is going through that filter. And we consider that the first-hand user. But as that cigarette is burning, what about the persons in the environment? Does it harm them? And yes, we have learned that what is now called second-hand smoke contains a lot more than nicotine. It contains thousands of other chemicals and causes over 1 million deaths yearly. It causes increases in cancer, increases in respiratory illness to persons who are not smokers. So let's pause there for a second and understand. There are the risks that tobacco is causing to the user, but then there are the risks that tobacco is causing to the persons in the environment. So the persons sitting there who are not smokers, the children who are there, they are all being affected, and their risk of cancers, their risk of respiratory illness, their risk of problems is also increasing, even though they are not smokers. And that is what has led, if you notice today, in many public places and in many environments, we restrict where persons can smoke, and even where entrances are, we have restricted how close the persons who are smoking are to those entrances. And all of this is an attempt to reduce the impact of secondhand smoke. We even now have what is called third-hand smoke. That tobacco, many of us, if we get into a vehicle or we interact with somebody or we go into a room, we may say, hey, was somebody smoking in here? And that toxic residue from the tobacco will stick to surfaces. It will be there in the environment, and it can remain there for weeks. Now imagine a child coming into that area, and the child is touching the surfaces or the child is inhaling that air. So that is a visitor to that location where. So we talked about first-hand, the actual user, second-hand, persons in the environment, and third-hand, a person who was not in the environment but then interacts with a space where somebody who was smoking was before. Now, what are the main ways we help people to try to quit? Many people will say to you, and all of us have heard this, what's called cold turkey. A person says, yes, I can quit and I am just going to stop. And that works, but it works very rarely. We then have all of the replacements. So we are going to try to replace the nicotine. And we talk about the patches, the medications that we go along with that. We have to add counseling. And today in the world of digital technology, we are going to use digital tools and tech support to so we need to have a full armamentarium of tools, medications, behavior, support groups, all of these things to help you. Coming back to the question of does quitting cold turkey work? It works for some, but the rates are very, very low. 3 to 7% of the persons who attempt to quit tobacco by cold turkey will succeed. And we know this. We know that, for example, it may take people 10 times of trying to quit. And that is one of the key things we want to get across to persons. Not everybody is going to succeed the first time, the second time, the third time. We know that this is a continuous process and people will try, fail, and our job is to continue to support you. So we have nicotine replacement therapies. We all know, have heard or read or seen the patches, the gum. And these increase the success by reducing your withdrawal symptoms. Many persons, when you speak to them, just the act of having a cigarette, the tactile, the use of their fingers, and when they associate having a cigarette. So those are the things that have to be discussed. So when we are changing your behavior, we're working on that. Now, what about medications? Yeah, again, as we have discussed with other substance abuse, the substance, in this case nicotine, is triggering a response in your brain. It is causing you to have certain cravings. And so what we need to do is the medications have to be targeted towards helping you manage those cravings, managing the response you get from the brain. And so these are the medications which we have to help you, that are going to help you by modulating those responses, which is going to help you with the withdrawal you feel from avoiding tobacco, and is going to improve your success rates in terms of being able to quit. What about counseling? Why is counseling important in quitting? Now, as we mentioned, in almost all aspects of substance abuse, there are triggers. Something is going to trigger you to use the substance. There are going to be stresses in your life. So what counseling does is to help you identify what are the triggers, what are the stresses in your life, and how do you develop different coping strategies to help you deal with these triggers. So instead of going to tobacco, instead of going to another substance, you're finding different strategies to cope and for you to stay motivated. So what we're going to do is we're going to combine the medication with the therapy. What have we found works best for quitting tobacco? There is no question that the most effective approach is a combination of therapy, medication, and behavioral support. That we have found will raise the success rate to over 30%. So yes, it is not going to be helpful if you're just taking the medications or if you're just having the therapy. We are going to use the combination of these to enhance your success. Now, what about technology? We live today in a very, very tech world, a very digital. And many times these platforms are there and they're available. So when you're having one of these triggers or when you're having a coping strategy, these applications and text messaging and online support programs give you sort of ready access to coaching. It's tracking and helping you. It's providing positive feedback and encouraging you. We have found that all of these, as we embrace these newer technologies, they are improving the rates at which people will quit. Now, what are the things that will improve your chances? You can't be in denial of this. You have got to understand, as with most substance abuse, the person who is abusing the substance needs to recognize that there is a problem. They need to have a desire to go away from the substance. So there must be strong motivation to do this. There must be social support. You have to have support from your spouses, your family, your network of friends. There's got to be the development of a plan on how you're going to quit. And every time you fail, every time you don't succeed, we are going to learn from that. And you are going to learn from that. Because it will be, these were the triggers, these were the challenges that caused me to go back to the substance. And as you learn that, and as you empower yourself, with every one of these cycles, you're going to improve the likelihood of your success. So that leads to the question, why do people relapse after quitting? And with all of these challenges that we have, we're not going to remove triggers. We're not going to remove stress in our lives, right? Every day we encounter, whether it's driving on the road, whether it's blockouts like we had, whether it's work challenges, whether it's personal challenges. So triggers in our lives, stresses in our lives are not going to go away. What we need to do is learn to respond to that. How do we respond to cravings? How do we respond to the desire to go to these substances? So you have to have a plan. If you don't have a plan as to when these triggers occur, when these challenges occur in my life, how am I going to cope differently with it, rather than, in this case, as we're discussing today, going back to the substance, going back to the tobacco. Now, what is the final key message we want to get across about tobacco? Tobacco kills. Tobacco kills. And it kills up to half of its users. There is no wrong time to start. No matter where you are in your use or your abuse of tobacco, you need to work on quitting. We have found that no matter where you are, quitting tobacco has a significantly positive impact in reducing your risk of disease, whether it's lung disease, whether it's cardiovascular disease, whether it's peripheral vascular disease, whether it's cancers. Quitting tobacco. And so what I would like to encourage every one of your our viewers is to strongly consider quitting. Now, for our viewers, you have listened to many of our episodes, and especially all of the episodes where we spoke about cancer. And it may sound like a broken record or what we call in healthcare a recurring theme. In almost all of the cancers that we discussed, we spoke about the link between tobacco and cancer. So, to summarize all of this, tobacco linked to cardiovascular disease, linked to deaths. Tobacco linked to lung cancers, linked to deaths. Tobacco linked to lung diseases such as COPD, linked to deaths. Tobacco linked to cancers. especially lung cancer, but certainly other cancers. So we are begging you, please speak to your healthcare practitioner. Please look out for the support groups, and they are help, and we will walk with you in your path towards quitting. On that note, thank you to our viewers for watching this edition of Ignite Health, brought to you in collaboration with Caribbean Surgery Inc. Tune in next week as we discuss even more important medical issues affecting real people. And remember to send us your health-related questions so our experts can answer them in the next edition of Ignite Health.